I'd say that change for an organization is important because it reflects the organization's willingness to grow, particularly as it involves the processes that have been around for a while. So within healthcare, we are used to doing things in a very set way. There's actually been a lot of change recently, but we're in a overall sector that has done things very much the same for almost 100 years. So every little incremental bit of change, particularly in healthcare, is felt acutely. But for change in general, it really reflects an organization's willingness to embrace doing things differently and accepting innovation, particularly when it means giving up power that accrues to the way that people used to do things. The challenges of change in healthcare is that we have people who are very highly trained to do things, and then they have a long career of doing them. Right. So they're trained in their 20s and early 30s to do a very specific task. And then for the rest of their career, they hone that skill. But any change to the way that they've been taught is a threat because it underlies the way they do things, what they were taught by people that they respected. We introduced a longitudinal medical record, essentially something that tracks you from birth to death and everywhere in between, so that when any physician within the Carilion Clinic system pulls up a patient, they're not only looking at a current snapshot of the patient, but also that patient's medication, allergies, medical history. They can see the last time the patient was in the emergency department, the outcome of the last patient's surgery, so that instead of gathering information, and it's often said that a physician spends 50 to 60% of his or her time just gathering information, all the information that a physician should need is right there in front of them, and they can focus their efforts. So the community has entrusted Carilion with its medical care for many, many years, and we have a stewardship obligation to provide good care to the community, which means balancing financial resources with our infrastructure, with the lives that we cover, with the health and welfare of our doctors and nurses. And keeping all of that in balance while we're trying to grow the clinic is quite challenging. In 2006, there were a number of changes that were impacting medical care. One was lack of physicians. Overall, we saw the number of specialists and primary physicians going down, particularly their availability to move to our area, plus the way that the payer mix worked. We're only being reimbursed as a portion of the actual services that we provide. So it's very challenging operating in a financial model like the payer reimbursement rate is in the United States today. So something needed to change. And when we looked at the different ways that you can run a health system, we thought, one way to tightly control costs but deliver higher overall quality of care by reducing unnecessary procedures and then making sure that all of the specialists that a patient might need is by hiring them or at least bringing them to the local community. And all of that pointed us to the clinic model.
Okay.
Even as we've grown more efficient in what we do, and you would think that means fewer jobs, we're adding a number of services. Yeah. So even while we've become more efficient in our billing processes and our care processes, we have added in the past 4 years about 200 new physicians, about 12 new major physician practices, and purchase process of getting the patient in, making sure that you know what the patient's conditions are, having all of the tools in front of you, having the time and the luxury of time to sit down with the patient, figure out what's going on, and then all of the specialists right there to be able to meet the patient's needs right there within a limited scope of time. That process is the star of the Mayo show, and that's what we wanted to bring to Southwest Virginia. Certainly we have very, very talented physicians, but it's the environment in which they operate, which is full of the right resources, very collegial, and quite frankly, fun for physicians to operate in. So it's not difficult to pick up a colleague and call and say, hey, I've got a challenging case here. Would you mind coming over and meeting with this patient? That's the environment we've tried to create.